Welcome to our Wellness Wednesday Health Show. I'm your host, Dr. H. Khalil, DC, founder of Back Pain and Sciatica Center of Texas, Houston Neuropathy Solutions, and Houston Stem Cell Solutions. Our goal in bringing you this show is to help share relevant health information that can benefit you and your family. Now, I want to share some things I've learned during this past week. I've had two different conversations with local law enforcement here in Montgomery County, and they both shared with me some very sad facts of what is happening right now. That currently suicides and child abuse are significantly increased over these past couple of weeks. Already, statistically, suicide is the 10th leading cause of death in America. And what they both said is here in Montgomery County, there's people who are depressed, people who have mental health illness. You combine that with now they're isolated, they're not able to go to work, they're alone, and they're worried, they're afraid, random thoughts go through their mind, and they're committing suicide. In fact, one person thought they were not, but they thought they were infected with the COVID-19, and they had some sort of mental image of what it was going to do to them, so they actually hung themselves and left 3 small children behind. And they both reported that they're responding to many more calls of domestic abuse, of both child abuse and spousal abuse, because men are at home, they're frustrated, they're angry, they're not going to work, some have lost their job, they're at home drinking alcohol, and it just creates a perfect storm where we see these terrible things increasing. That's why today's topic is so relevant and timely, and I'm going to introduce it by sharing an article that was in the New York Times on April 2nd. It says, FDA approves the first coronavirus antibody test in the US. It goes on to say, such a test may help scientists learn how widespread the infection is and how long people remain immune after recovering. It goes on, this test is important for several reasons, because people with immunity might be able to venture safely from their homes and help shore up the workforce. And it may be particularly important for doctors and nurses to know whether they have the antibodies. And so to go over more about what this test is, our guest today is Dr. Tony Garbs. He is a functional medicine specialist. He is the founder of Mount Bellevue Family Wellness, which is a holistic integrated practice. And he's one of the first doctors in the nation who has begun working with his local city and county officials to have these tests performed on the city workers so they can have greater confidence in helping to return them to work. So I'd like to introduce you to Dr. Tony Garbs.
Thank you. Thank you, Dr. Hewlett. Happy to be here. Although I was, found out I was the second guest, I don't know how I feel about that, but of your show.
Well, thank you for being here. Now, one of the questions as we were talking before we started the recording was, what is the difference between an antibody test and the test that someone would have at the hospital right now?
Yeah, that's a very common question that we're getting. So the current test is a nasal pharyngeal swab or an oral pharyngeal swab where people are familiar with that, like with the flu test. And that's checking for genetic material and presence of the virus actively. So if you are presenting with the symptoms and you present to a hospital or a clinic that's testing or a drive-through, that's the test they're going to use. And that's probably the test you should use in that acute situation. The problem is there's up to a 40% false negative. What that means is that up to 40% of the time the person has it, they swab, maybe the swab was done incorrectly. There's many different factors that can cause that, and then the person leaves thinking they're negative, but they're still positive. So that could be, a problematic implication that they may go around and continue to spread this. Now, the antibody testing is testing your immune system's reaction to the infection. So this is not necessarily for somebody that's acutely infected, although you could, but what it's really designed for is the 90-some-odd% of people that were either asymptomatic or they've had it in the past. And that's what we want to check with the antibody test is your exposure and your potential immunity to it now.
Okay, so the hospital is for people who are actively have symptoms and think they're infected with it. What you're saying is this antibody test is for people who don't have symptoms, but want to know, have I been exposed to it in the past, and has my body already developed some sort of immune response? Is that correct?
Yes, exactly. That's what we're looking for.
Now, why is this test so important? In the article, it went on to say that Great Britain has ordered millions of these tests and begun performing them, as well as several other countries have begun ordering these tests. What's different, and why is it so important to get tested for these antibodies?
Well, it's a way to get us back to normal, right? We can get our economies going again. We can get a lot of people back out into the community, especially essential workers and people that need to run the country. And right now they're being quarantined or having to work remotely. Well, we can start to mobilize these people back into the community if they've already been exposed. And so you have other countries like the epidemiologist from Oxford. She had an article last week, and she was saying she predicts half of the country, she thinks half of the UK has already been exposed, and she's wanting to get antibody testing out there to show that. And that's why it would be important to show who's already had it, it's already ran through them, it's already taken its course, and who can then kind of come out of isolation or quarantine.
Okay. Now, there's two different types of immunity. There's innate immunity and acquired immunity. Innate immunity is something that we've been talking about a lot with our patients. That's your natural built-in immune system that we all have. We have white blood cells, we have natural killer cells. Their primary responsibility is to seek and destroy foreign substances like viruses and other infections. And that's for new virus infections and bacteria that we've never been exposed to. Our innate immune system defends against those. And then we have acquired immunity. And what is that, Dr. Garbs? I think that's more what you're talking about.
Yeah, exactly. This test, that's what it's showing. That's what we're measuring is after you acquire that infection, even if it's brand new, and most of the time it is, right? So like we're talking about the SARS coronavirus 2, this new breed of coronavirus, it's new to us. And once your body, comes in contact, you're going to build this acquired immunity, which is basically your long-term immunity to it. And so the reason why that's important is the next time this comes around, right? Because this potentially isn't going away, right? So we may have other waves. You're going to be more protected. Your immune system doesn't have to then build up antibodies to it. You already have the antibodies, and it can go straight to the virus and attack it immediately instead of taking many days and you going through all the symptoms and things like that to actually kill it.
Is this similar? I'm old enough to remember when we actually got the chicken pox. Is this similar to that when I got the chicken pox as a child and now I don't have to worry about it as an adult?
Exactly. Yeah, same thing. Our parents, it would have been measles, right? All of our parents in that generation, they got measles. Same thing. You get the wild virus, and then you actually build up an immunity to it, and you don't get it again. In fact, there's studies showing if you acquire the wild virus, you actually have more of a protection for the variants that are to come, right? People talk about that with the flu all the time. The flu strain changes annually, but if you had a good flu and you actually let your body run through that, build an immunity, you're more protected in the following years, even if it's not the same exact strain.
Okay, that is very interesting. Now, if someone has this test and it comes back that they've been exposed, they haven't acquired immunity, they don't have any symptoms, but they have the antibodies, do we have to worry about that person being a carrier? We hear a lot of the news right now about these carriers.
Right. So I lost you a little bit. Repeat that question.
If someone has this test and it comes back that they have been exposed, they do have the antibodies, meaning their immune systems has developed this acquired immunity, do we have to worry about that person being a carrier to spread the virus?
Oh, no. Only now the test will show if you've had a recent exposure. And during that time, you would want to consider quarantine and even having the PCR nasal swab to see if you are acutely having that genetic material in your body. Then you would want to be identified and then quarantine so you're not spreading. But the other part of the test is showing us when you start having those IgG and IgA antibodies, we know you've already transitioned from the acute phase into the immunity phase where you're starting to build a long-term immunity and it's no longer in your body.
Got it. So this test will show have the antibodies, and it'll also show based on some of those different IgG levels that I'm not a carrier, right? It's not an active state, so I can't spread the disease, but I can have a greater confidence going out knowing that I have the acquired immunity. Is that correct?
It's exactly, that's what they're finding out. They're finding out, basically early on, you're carrying that genetic material, and you could spread it through, they say as simple as breathing now, but it used to be aerosolized, right? Like a cough or a sneeze. you have the genetic material, you're spraying it out, potentially you can even, breathe it out now, they're saying, but that's only when it's in its early phases with you. And that's the dangers about they're saying the asymptomatic. Somebody is carrying the genetic material, they're not expressing symptoms, so they're going out and about. So that's why this test is important. We can start identifying, who's already had it, who needs to be careful, and who doesn't have to be.
This has a potential to be just a huge game changer and shift in this pandemic we're in.
100%.
Can you tell me a little more about how the test works?
Yeah, if you want me to, you want to pull up a little slideshow for.
I think that'd be great for all of our viewers.
Okay, so let me do that. I'll just share this screen, and I can kind of run through some of the slides. All right, so, and not to take too much time, but I'll kind of go into, we talked about this testing, the swab testing. There's, that slide is showing there's at-home kits that people can consider so they don't go to a hospital and spread it. But that's totally different from the antibody testing. So antibody testing, again, for people to understand this gets confused, it's not checking for an active infection, it's checking how your immune system reacted to the coronavirus, specifically this one, this company. Now, there are some other antibody tests out there. I think President Trump was talking about this yesterday. They were worried about some of the ones coming from China not being effective. Now, there are some like these here. These are accurate tests. The problem is, the reason why I chose a different company, and I have these up here, is they're only checking for one antigen of the virus. So you could potentially miss it. The company that we decided to use after researching is Vibrant America, and they're testing for 4 different antigens, 4 different pieces of that virus. And those are some of the pieces there. You have, you hear this in the news a lot, there's spike proteins, that's how it attaches itself to your cells. So they're checking for the S1 and S2 version, also the receptor binding domain and the nucleoprotein. So the 2 I just showed you, the other popular tests, there only one company is testing just the receptor binding domain antigen, and the other company is doing the nucleoprotein, right? And I'm gonna show you why that could be problematic and why I chose to use Vibrant, because they're giving us 4 different antigens. So again, you and I were just covering this. Early on, you have an antibody called IgM, which is kind of your first line of defense, right? I've heard you say it like this too, Dr. Hewlett, where your immune system's your army, essentially. So these are the first responders. These are the ones on the front line. So they go out and they start attacking the virus, and we will see a rise from around day 3, peak around 7. And if this is elevated on your test, we would know you're in a early phase, right? So you had a recent infection. That's when we may consider some different actions. Now, around that time where it peaks, IgG picks up. Now, this is your immunoglobulin G, is more of your long-term. This is showing us you're converting, you're transitioning from the M, the acute phase, into the long-term phase where you're getting the potentially lifelong immunity. Our pictures are covering that, but this shows it drops off, but it may never ever drop all the way to 0. So these may just keep going lifelong. Too early to tell, but that's how it's with many other viruses. So why would it be any different than this one, they're thinking? Next, and stop me at any time if I need to cover anything else or clarify. Now, next, here's an example. So this is a patient's test. So, and this is from Vibrant because we have all 4 antigens. Again, some of the other companies, they only have 1. Now, this person was IgM positive. So this is the one in the scenario we talked about. Hey, this is a recent exposure. This is the person that would need to consider having the nasal swab to see if they are carrying that genetic material still. See if they are positive, then they would need to follow all the county's guidelines to keep themselves quarantined so they're not able to spread it to anyone else. Now, let's see, next example. So this one, we have a patient that tested positive. They're starting to transition. They're starting to move over from this protein into the IgG, but they still have a little bit of M. Now, one thing that was interesting is one of the companies I showed you, they only test for receptor binding domain. They would have completely missed it. So this person would still think they haven't been exposed, and in fact, and still have a lot of anxiety, right? But in fact, they were actually exposed to it, and they're already building some lifelong immunity to this. Now, the other company on this example, they would have got it. So the nucleoprotein did show up. So that company would have got it. This company would have totally missed it. Another test panel. This one is a person that's doing, he or she is going all the way over to long term. So this is that person that was probably like, hey, that wicked cold I had back in January, I knew it had to be the coronavirus. They had a cough that lasted, had a fever. That's these people that they think they've already had it maybe back in December, January, February. They're already transitioning into their long-term immunity. One other thing I went over in a slideshow that I did a few days ago is this person's important because there's the new therapy, right? So some of these critical patients that are in the hospital that are needing supportive care or even vented, and they're very critical, they found, and they're doing it right out of Houston, they're taking the plasma, right? They're taking the plasma of somebody that's beat corona and is presenting with these IgG antibodies, and they would be a great candidate to potentially save someone's life.
So they're actually they're using these for treatments. They're taking the IgG antibodies that one person's developed, and they're transferring that over to someone who has an active severe case for treatment. Is that correct?
Absolutely. Yep.
Okay.
And they're doing that.
Wow.
And then also, if we were to take this one company that only tests the nucleoprotein, they would have been negative and they wouldn't be a candidate, right? So that would be a problem because this person actually is a candidate, to donate, plasma. So that's why we chose this lab. It's the most advanced one out there. It may change, and then we'll change, But I always encourage, if anybody knows something better, to always share it, because that's what we're looking for. We're looking to deliver the most cutting edge test and researched therapies and tests for our patients.
I'm thinking of the implications here where, like, you mentioned the city, that you got a contract with the city, where if someone tests this, or healthcare workers, where if there's a doctor or a nurse and they had this test and they could say, hey, I have not been exposed, and they need to be extra cautious. Someone who has been exposed, they still need to be cautious, of course, but at least they know, hey, I have some of the antibodies inside of me, and I know my body has both the innate immunity and the acquired immunity to be able to fight this. And so it gives their body a better fighting chance of getting out there and being able to return to some normalcy and getting back to normal. And it helps identify people who would say, hey, you need to be more careful. Well, let me rephrase that. We all need to be careful, but you should definitely be extra cautious. And you have both acquired innate immunity. You can start getting out in public. You're not going to be a carrier, but you can also start getting out there and returning some vital functions that need to. Is
Right.
in
And in fact,
go ahead.
yeah, in fact, I was going to say that's what our actual city's doing, and we're going to try to encourage. Hopefully, we set a precedence by this, right? Our city's actually doing what you just mentioned. They're going to test all their first responders and all the critical employees of the city that are in contact with people right now that have to, because they're essential jobs out there, and they want to test them and start identifying who already has immunity and who's who can be out there safely and feel confident being on the front line, so to speak.
So is the city, I just think that's phenomenal that you're working with your city officials. Is the hope of the city then that they can identify certain employees that need to work at home still and certain employees that can return to work at this point?
Exactly. Yep. And that's what you can use this information for. And that's why this will be, amazing for the whole country.
Oh, this is like I said, this has a potential to be a huge game changer, I think, for all the communities and people feeling more comfortable about whether they need to continue to self-quarantine or whether to go on. Because I've talked to a lot of people and they're like, okay, I've self-quarantined for 14 days, 21 days. We see in the news, is it self-quarantine for 3 months, 6 months? There's a lot of numbers being thrown around out there. I think this has an opportunity to give someone confidence to be able to leave the house and
It
knowing they have
does.
some greater immunity.
Absolutely. And the company we're using, they're in New York right now, right? They're testing how they're getting so precise in their data. They're finding every day, they're measuring people's blood, finding out what is their immune system doing from day one when they're hospitalized all the way to when they recover, right? So they're getting amazing, information where they'll come out with even more, info for us to be able to feel super confident with this. And one thing I wanted to encourage and not let that pass over about the cities, hopefully this starts a domino effect, right? Hopefully it's not just our city, all the cities. And if any of, your patients listening have contacts to your city, I mean, I would encourage them to connect Dr. Hewlett with city officials to make this happen. I think it'd be very important, because you're going to be offering this test as well, is to connect you with your city.
Yeah, so we've begun in the last couple of days. We began walking with Dr. Garbs and the lab test and the companies that he's affiliated with, so that we can bring it here to our community. And if we can get this in more and more communities with our first responders, with our government officials, we can start there and then we can work into other industries. But I just think that's humongous and a big game changer. So as we're wrapping up, we're just about out of time, but maybe just a take-home message. So just to summarize, if someone has this test and it comes back negative that they have not been exposed, what does that mean for them?
So they would want to consider right now how, and so if it's negative, it means you haven't been exposed. So you would want to, look at your own health. If you have risk factors, or maybe you live with somebody with risk factors, you're going to want to do the isolation thing still. I mean, you have the potential, if you, like I said, if you could be a potentially critical patient, you may want to stay safe. Okay. But if you're negative and you haven't been exposed, but you really don't, and this is another public health issue, but I'm just saying personally what I would do. If you're healthy, you're going to most likely do fine with it. So you just have to take those into consideration yourself. The main thing is making sure if you're healthy, you could transmit it to somebody. So you got to be like, who are you coming in contact with? Are you taking care of an elderly patient? Do you have people that you're in contact with that take care of critical patients? So just be mindful of that.
Okay. And if someone has this test and it comes back positive that they were exposed to it, they're not in the acute stage, meaning they're not a carrier, but they've developed those other antibodies. What does that mean to them?
You're ready to rock and roll.
Okay.
You're ready to go out. Again, it's so new. We have to see what the governing officials say about that, but that's why we need the data. That's why we need everybody tested so that we can then present these papers, right? Hey, here it is. We've already been exposed. It's already ran its course. Now what do we do? So, I mean, you can't go rogue, right? We can't get the test and then go rogue with this. But if we get enough data and present this to our county officials and the judges making the laws, or the governor, I mean, we're going to see some sort of change. Or the president, like I said yesterday, he's calling for more and more antibody testing. So I think this is the answer.
Well, I think it's just tremendous that you've been able to make some headway in your community, working with your city and county officials. And we're excited to be able to do the same thing here in our community. So we will have these tests. We're getting everything set up today, actually. So by, this week, we're hopeful to be able to have these tests in the office. So give us a call, 936-494-1222. That's 936-494-1222. And as soon as we have these tests available, we'll let you know that we can start performing these. Dr. Garbs, I know you have a busy clinic. You need to get back to your patients. So thank you for making some time and sharing with us is just phenomenal information about these antibody tests. And like all of us, I think watching this call, we're hopeful that this will help us just accelerate the process of the healing that needs to occur from a health perspective, from an emotional perspective, from an economic perspective due to this COVID-19. So thank you for being with us today.
Thank you. Thanks for having me.
All right. Signing off till next week. You guys have a great one.